Well, I'm so happy to meet you, Dr. Sadia Niazi, from England. When I was first told about your research, and I made myself acquainted with it, and I read your article, your abstract, and certainly some of the interview questions that were done before by the AAE, I was really your answers in particular. I was really blown away with your dedication to this very important topic. So in preparation for today, I noticed that you are in the Department of Endodontics, but I was hoping that you could actually tell us a little bit more about your academic background, and your particular research lab and that sort of thing, please.
Thank you so much, Dr. Usman, for your kind words. Before my introduction, I would really like to acknowledge and thank American Association of Endodontics for doing this podcast to raise awareness regarding such an important and timely topic. And I'm really delighted and I'm really honored to be among you guys and talking about that. So regarding myself, I'm Dr. Sadia Niazi. I'm an endodontic consultant and a senior clinical lecturer at the Faculty of Dentistry, Oral and Craniofacial Sciences at King's College London. And over there, I'm also head of the undergraduate BDS endodontics program. In addition to my clinical and teaching roles, I also serve on the board of Royal College of Surgeons Dental Specialty Fellowship Examination. I'm fellow of the Royal College of Surgeons of Edinburgh, member of Royal College of Surgeons of England, and also a council member for the British Endodontic Society. And yes, my research, it focuses on understanding these host microbiome interactions in apical periodontitis and how these dental infections and then the treatment we provide for these, they influence the general health of our patients. And I'm truly excited to be with you because today we are obviously talking about this really important topic.
Well, wonderful. And again, to have such a highly qualified person in our midst is certainly, to coin a British term, brilliant for us. So thank you so much. So, one of the things, and I would be lying if I didn't say that I'm also fond of looking at things on social media. And there's a lot of buzz about inflammation in general and how inflammation basically affects systemic health. And I know that this is essentially poses the question about your research. So I was hoping that you could, we see it in how we control diet, how we, move our body, that sort of thing. Could you speak specifically from your knowledge base about how inflammation in the body affects overall health, just to kind of give us a little bit of cursory education on the topic?
So as you said, yes, when we talk about the oral health and general health, they are quite closely connected. And actually, these connections between these two diseases, they are in the center of the global health discussions. And I would say that how these diseases, they are connected is mainly, the infections which are in the mouth. They are caused by the microbiome, and these microbiome, they can spread into the bloodstream. And once they're in the bloodstream, they can trigger the chronic systemic inflammation. And that is how the long-term, low-grade systemic inflammation, they can impact the general health. And they can lead to the alteration in factors which can increase the risk of chronic conditions like diabetes, like cardiovascular disease. So this is how these two, areas, they are connected. And I'd like to say that with regards to, these links, when we look back previously, of course, the links between the gum disease, which is obviously gingivitis, periodontitis, and the general health, it had always been given quite a lot of attention. And yes, this was the area of, the oral diseases, which was quite well, researched and well recognized. But one of the things which I thought is probably missing in the discussions is how our, root canal infections or the apical periodontitis, it is seen with regards to its impact on the general health. So and then when we look at apical periodontitis, it is again one of the, it's quite prevalent. It's almost, the third most common oral disease in the world, which affects almost 50% of the global population. So when you look at the high prevalence of this, when you look at, apical periodontitis, which obviously is, when you compare it with periodontal disease, biologically, these two conditions, they actually behave quite similar, in a similar way. They have the similar microbiome, they have the similar inflammatory pathways which connect these conditions with the rest of the body. But again, when you look at the impact of apical periodontitis, that somehow had not gained much attention. And I think this was one of the main things which has driven my research, just seeking answers to this question that if this apical periodontitis, it is so widespread, could it be that it is silently contributing to have some impact on the rest of the body? And importantly, what happens to the body when we treat these infections? And I think seeking answers, I think we are, now standing at a lot more, stronger scientific evidence that we can see that apical periodontitis is also within the bracket of all those oral conditions which have an impact. If they're left untreated, they can negatively impact the general health of our patients.
So one of the things that you have mentioned is the fact that, we should not be in silos. The oral cavity and the body are one, and that's precisely why any disease in the mouth needs to be sought to be treated because of its broad standing implications. That's kind of what you've alluded to. I wanted to, again, educate our viewers into understanding a little bit about the actual cascade that's happening. So if you don't mind going into a little bit of detail, you've mentioned the biofilm or the microbiology, but can you take us one step further and talk about how that leads to inflammatory mediators that may jump into the bloodstream? Just a little bit more detail, please.
Of course. So obviously, when we have these root canal infections, so these infections, they're not just confined within the root canal of the tooth. They are, there is a pocket of infection also around that tip of the root. And those bacteria, those microorganisms which are present in there, and then especially the chemical mediators, the toxins that they produced, they can they can continuously damage the surrounding bone in the jaw, which is around the tip of the root. And the important thing is that it does not stay just localized within that jawbone. It is in close proximity to the blood vessels of the jawbone, and it is through that connection that those bacteria, microbes, those inflammatory mediators would basically spread into the bloodstream. And once they are in the bloodstream, they gradually lead to that, trigger of that chronic state of inflammation. And when that inflammation, it stays there for a longer period of time, and this is especially if the tooth is not treated, if timely treatment is not provided, then what happens is that it leads to alteration in the metabolism of, sugars, metabolism of certain, fats. And what we start seeing is that rise of certain, inflammatory markers, which are the risk factors for the development of diabetes or cardiovascular disease. And that basically shows that the body is constantly fighting against that infection. And in doing so, obviously, it is disrupting the normal metabolic processes. And that is why it's putting, a body continuously in that switched on mode. The immune system is continuously fighting for that infection. And obviously, that is what is disrupting and having an adverse impact on the rest of the body.
That's incredible. I love the way you explained it. We can all understand this process. I kind of wanted to now have you explain a little bit about your research design, because I think what's pretty amazing is that you've taken something that's theoretical and you've actually taken modern research design and protocols and applied it to come up with astounding conclusions, quite frankly. So would you mind sharing with us your research design?
So in our study, it was carried out on patients that had apical periodontitis. But in order to, reduce all the confounding factors, we were quite strict in our inclusion-exclusion criteria. So we only included healthy patients who had apical periodontitis. And they were the ones without any, diabetes, any other medical chronic conditions. They were not taking any sort of a medication that can alter their, generalized inflammatory state, like modifying medications, etc. And we collected, obviously, certain samples. We collected some blood samples, serum samples, some intracanal, samples from those patients. And the study, which has been lately published in the Journal of Translational Medicine, that builds on our previous findings. In our previous studies, we have looked into certain inflammatory markers, and we looked at the baseline, and then we looked at longitudinally after we treated these patients for a period of 1 year and 2 years. And we saw, we basically monitored the alterations in those particular markers, which are also risk factors for the cardiovascular disease, such as certain CRP levels, certain interleukins, asymmetric dimethylarginine, so particular markers. And we also looked at patients' clinical metabolic syndrome indicators, like patients' HbA1c. We did some blood lipid profiles of these patients longitudinally to see the changes following the treatment. And in the previous studies, what we found was that once we treated these infections, we saw that there was a reduction in the level of these biomarkers over the period of time. And the reduction was, more pronounced when there was a complete healing of the bone around the tip of the root, meaning that once the infection was gone, we saw a reduction in the levels of those particular markers, inflammatory markers, which are risk factors for the heart disease, for diabetes, etc. And when we compared those markers at the baseline with the healthy controls, we saw that their markers, they were quite higher. So presence of apical periodontitis was potentiating those markers and increasing the risk of the patients towards the development of those chronic conditions. But once we treated it, and as we saw that there was a healing in the periapical area, there was gradually reduction of the levels of these biomarkers. Again, for those HbA1c and cholesterol levels, we saw that there was a reduction in this level. Now, this study, which now I have carried out, I have used a metabolomics approach. So I have profiled the metabolites, 45 different metabolites in the patient's serum on all those longitudinal, samples that we collected from the baseline and also longitudinally over 2 years. And what I wanted to look into was what are the mechanistic pathways, what exactly is happening in order to get a little bit more in-depth answer of why we're seeing these changes. And what we saw eventually was that after the root canal treatment, there was reduction in obviously sugar levels. There was immediate reduction in the levels of cholesterol, and a certain amino acid, especially branched chain amino acid, which are linked with the insulin resistance, with the cardiovascular disease. We also saw that there was a reduction in this level. And another particular marker like tryptophan, which is generally associated with a high risk of cardiovascular disease and chronic kidney disease patients, we saw that its levels, they started increasing, and its high levels, they have a positive impact on the heart health. So seeing it rise again was a positive, thing that we saw after the treatment. So collectively, it's a quite comprehensive study, and obviously it's taken me these past 7-8 years to collate all this information. But what we have found is quite a strong evidence, quite a robust evidence, which shows that when we do the root canal treatment and when there is a successful outcome, then and a healing occurs, then there is overall beneficial impact on the rest of the body with the reduction of all those oral risk factors, which could be contributors towards those other chronic health conditions.
That's incredible. I didn't realize that this was set, like your research was designed 7 or 8 years ago. I know that your follow time was 2 years. So that was actually one of the questions that I was wondering, is that were you able to see manifestations? Have you followed some of those people long enough to see manifestations of reduction of those markers in terms of a subjective assessment of their sense of health? Because I think at the end of the day, all research needs to translate to how does this impact me personally? How can I use this information?
Yes, absolutely. So I think that research has to be, obviously starting from the basic research. It should have a bigger question to address, which can actually, impact the clinical practice, and we can bring it into the translation. So, of course, in our study, as I said, that we were also looking at the patient's clinical, chair side. We were doing the test for patient HbA1c and other levels, and along with, seeing the other changes in the metabolites, in the inflammatory markers, we also saw that there was improvement in the levels of their HbA1c and lipid profiles.
Wonderful. Now, so you know what, coming back to endodontic infections, and I want everyone to understand that these periapical radiolucencies or periapical infection, as we're defining it here, is because there's some sort of necrotic tissue inside the tooth. These are root canal infections specifically. And so how we typically assess healing is, as you mentioned, we see bony healing and loss of acute symptoms. We know that treatment of endodontic infections differs, whether it's a retreatment or a virgin case, if you will. I presume that these were all virgin cases, correct? Or were there some that were retreatment cases as well?
They were retreatment cases. The cohort of the patients that we treated, they were retreatment cases, and they were the ones in which the primary treatment had failed, which means that obviously, there is a more long-standing chronic infection which was present in these cases.
So that's actually yes. A higher bar. That's actually a higher bar to kind of try and heal, which makes me also want to ask the question, can you review with everyone what is the prognosis of retreatment through orthograde means? And these were all orthograde retreatments. And did you feel like that was concomitantly reflected in biomarkers as well?
So I would say that obviously it was a longitudinal study. So we started with a cohort of 65 patients, and we had, at 2 years time point, we had 37 patients that we saw. And this is the results which I'm telling you is the longitudinal of those 37. And all 37 patients, they were the ones that we saw, they had 100% radiographic success, and obviously resolution of those symptoms. And again, I would like to emphasize here one thing, that these were the patients who were seen in our postgraduate center at Guy's Hospital. So obviously, the protocols and the standard of the treatment that was being carried out was obviously of a really good high standard. So again, another important thing is to get this success, the implementation of the good, cross-infection protocols and the latest equipments, and sticking to those guidelines, it is the key to get this success. And then you see the improvement in the general, markers and general, health benefits of the treatment.
I think that's super important to emphasize, is that these were treated in the most up-to-date fashion with the most up-to-date technology by specialty level students. And so that's why we have actually more efficacy than likely is in though we have all types of people who may do retreatments. So we were really looking at the best treatments. So that's really, really, really excellent. I wanted to ask you, what is your vision of how this information, this is something that's been, it appears, your lifelong research. And I want to know, what is your vision for this information? How would you like it to be used? How do you see your further research developing? I know I'm asking multiple questions at one time. Feel free to answer one at a time, whatever.
I think this research is, this research area is very fascinating because it is actually, bridging that gap between dentistry and oral and general, medicine. So we are aware that, standards of healthcare, they've come a long way of how they used to be. Everybody is talking about preventative medicine, precision medicine. And I think when we look at it, I think what I see missing now is the acceptance and the incorporation of oral health and management of these oral diseases within the holistic care of the patients. So I think what you have asked me, it's a really relevant question, and that's where I would like that eventually we move towards this integrated healthcare system. And I'd just like to share that since this paper has been published, I have been contacted by many medical colleagues who are strong advocates of working together to provide this holistic care for the patients. And I can see that gradually, this publication and these discussions, they're really bridging that gap, increasing the awareness and increasing the profile of, and the significance of management, timely management of these oral diseases, in the overall, preventative care planning for the patients. Slowly but surely, we are moving towards the integrated care. And I see that maybe we are coming close to the time when we can see the dentist and the physicians, they work together to co-manage the patients, co-manage especially the high risk patients together. Maybe implementation of more efficient, smoother referral pathways, piloting some sort of piloting some programs for the high risk patients. And important thing is to include the education of the clinicians, both dentists and physicians, on these profound links between the oral health and the general health. I think it's really important that this should be part of even the undergraduate curriculum so that, this is recognized right from the beginning. And actually, if you see that if we incorporate the oral health assessments into this general medical, sort of practice, that can actually completely transform that preventative, management of these, patients who have chronic diseases like diabetes or heart disease, etc. So I would say that yes, it is timely, and this integration was always required. And I would like to still keep on, working towards providing more evidence and advocating for this integration. And in this regard, I'd just like to also mention that we have this IADR conference, which is upcoming. And I have organized with other speakers a multidisciplinary symposium, which is on 27th of March. And this is to raise awareness about oral health as a part of the other non-communicable diseases. So we are just trying to raise the profile, especially of apical periodontitis, within that umbrella of the oral diseases, which include caries, which include periodontal disease, so that it also gets recognition within the global health policies. And this is something which is going to further push bringing, the dental, sort of preventative care within the overall holistic care of the patients.
Yeah, I think we've been battling this concept, teaching our physician partners in health how relevant we are and how we absolutely have to have a seat at the table. So I think your research is so important. I feel like Perio, obviously, like you said, for the past 20 years has been having these conversations, but I feel your method of research is so objective because of the measurements that you're taking. It's so valid, and I feel like we know a lot more about inflammatory mediators now. So while it was suggested and certainly proven in Perio, I feel the time in which your research is being done really offers something very concrete. But I do want to focus on one thing, and that is the endodontist specifically, as the person who helps remove these infections. To the people who would say, listen, we acknowledge the fact that this is a very prevalent disease form. Why are we treating these teeth, period? Why are we not removing these teeth? Can you speak to that? Because obviously as endodontists, we know fundamentally what our work can accomplish. And you kind of gave that statistic with your graduate students. Could you please address this?
So I think this is a bit of a mindset sometimes we do come across when the patients, when the patients they come with or with this mindset, it's difficult to actually, make them understand. But important thing here to tell them is that obviously these infections, they can be symptomatic, they can be painful, but then it sometimes, they can completely go undetected and they are asymptomatic. But that doesn't mean that the infection is going to go away on its own. The infected tooth is still present, and as I said, that this infection is not, it's not going to stay confined to that tooth. It would continuously keep on destructing that that bone around the tooth. There would be more destruction of the tooth inside, and eventually that whole impact is going to be on the general, well-being of the patient. And this is important that we need to make them understand that doing timely treatment is really crucial, because if they delay this treatment, what will happen? One, their body would be constantly fighting against that infection. And in doing so, they are gradually increasing the risk, because if you leave this infection untreated, you never know what the impact of this would be over, months and years. Secondly, if you leave it for a longer period of time, as endodontists, we know that the infection, it can become so worse that it might come to the point that tooth is unsalvageable. And then obviously it comes to the point, then we're looking at an option of extraction and then replacement options, which again are costly, which are invasive, and they're never the same feel as natural tooth structure. So it's really important for patients to understand that doing a timely treatment is not just about saving that particular tooth, even if it's not causing any problem. The tooth is infected, and leaving an infected tooth is gradually going to have a bad impact on the rest of their health and the body. So this is how we need to address it. And I think this evidence is now there. And obviously this can be used for the informed consent, for the decision making, for the care planning of these patients.
Yeah, it's almost like if I were to come up with a slogan for what
Yeah.
your research is it's like healthy mouth, healthy body,
Yeah.
and naturally, of course, AAE has worked very, very hard to show how critical it is, as you mentioned, saving our natural teeth, and how endodontists are best capable of diagnosing and treating our teeth. And so that's kind of, I'm so glad in our natural conversation that we were able to extract some of that information. I feel like it's always so much more fun to talk to the researcher. So I'm going to ask you some things that you were really excited about your research, because I think in all processes we discover things that we had no idea that we were going to see. So I want to ask you, what surprised you as the results were coming through, or what was the thing that you were most fired up about, that you thought, you know what, I'm so thrilled about this?
I think the one of the fascinating things was that obviously, as I mentioned before, that um, I wasn't expecting that we would have such a massive improvement in those factors which are the ones which are linked with heart disease or diabetes. Obviously, this was a question that I wanted to address and see what happens to the body. But the fascinating thing was that as we treated these cases, we immediately within 3 months or so, we started that there was a shift of the body towards a better metabolic health. So we started seeing changes in those, gradually reduction in the levels of the sugars, immediate reduction in the levels of certain, the fats and cholesterols. And again, those amino acids, which are again linked to those conditions, we saw a reduction in the level of those ones. So overall, we saw that there was a shift of the body towards, better metabolism of the fats and glucose. and restoring the body into a healthy state once that infection was treated and once that whole inflammation it was gone down.
Yeah, I feel like we need like almost almost a patient-friendly version of your article to kind of share with our patients and show them how a lot of their, there's so many diseases that are triggered in the rheumatoid family, autoimmune diseases that are triggered by inflammatory states, and we're seeing that more and more. And just to know that patients can take responsibility for a lot of those things, and people don't realize how critical their teeth are, but in the grand scheme of things, but providing adequate nutrition, providing the anti-inflammatory diet, all of the vegetables that they need to chew, coupled with keeping their teeth healthy, is a critical part of systemic health. So I love the way that this all goes together, and I'm excited to see what comes out of your symposium as well.
So I would just
Go ahead.
like to add, Najia, that obviously, obviously our study was looking at what the impact of the treatment was on reduction of these levels. But at the same time, these links, they are bidirectional. So if the patient is diabetic or has the diabetes hyperglycemia is not controlled, automatically because of the impact of that, we would see that there would be reduced healing after the treatment. So it's all about educating again the patients that staying on top of your health is important, because even if we do the treatment might not be as effective as if compared to somebody who is otherwise fit and healthy. So that is important, that to advise them to stay on top of their diabetic control and to do those measures that keep their glycemia and everything under that safe range, so that there is a promoted healing following the treatment. So again, as these diseases, they're influencing the general health in the same way. The general state of the body is also impacting the prognosis and the success of our treatment as well. So yeah.
Wonderful. So let's pretend we have an audience of holistic medicine folks, people who are proponents of, because I know in some of your answers you use the word holistic. However, you are a researcher, and your research actually puts a feather in the cap of the evidence-based folks as well. Tell me how you merge these concepts. If you were sitting in a room full of people who are promoting holistic treatments, I feel your research supports them as well. So speak to them for a moment, please.
So, so Naji, just to clarify, are you referring to somebody like obviously on the social media we sometimes see people talking about the holistic like holistic.
Yes, exactly. They suggest certain alternative treatments from things that we as endodontists do in an evidence-based fashion, and I feel like we are merging that. So I kind of want I want to speak to them right now.
Yeah, no, thank you. I think I just wanted to clarify that this is exactly what you mean. And that's such a relevant question because, um, we see, all this social media misinformation flooding on different platforms, around that root canal treatments. And it is affecting, our patients. It's affecting public, even our dental students. And it's really important that, we should always trust science over any such theories which are being basically being just disseminated. I must say that now we are at a strong scientific evidence that we can sort of we can back up everything with the science, with the evidence. And it's important that we educate our patients based on that. Patients, they come up, sometimes they're very anxious about that. And this evidence is disapproving all that misinformation which is going on. We know that root canal treatment, it is safe, it's a routine procedure, and the main aim is to get rid of the infection which is inside. And in doing so, of course, we're not only saving the teeth, which is the best option for the patient, but at the same time, we are also improving the general health in the same process. So it has a wider impact beyond the mouth. And all this misinformation which is spreading, we know that sometimes these are influencers just trying to get traction. They make, those slick videos which are emotionally persuasive, and, they don't really care if they are spreading misinformation, but that is quite damaging for the patients. So my advice for somebody who comes across any such misinformation is, first of all, they must check a few basics. Firstly, that a person who is telling all this, is he a qualified professional or not? Secondly, it's really important that are they actually, referring to any strong scientific evidence, or they're telling their own personal stories? Because if they're telling a personal story, important thing here to understand is one person's stories doesn't apply to the larger public. And as I said, that if they come across anything which is too extreme or too good to be true, that is again one of the signs that is most likely misinformation. As I said, that the influencers, they try to attract people with that. And it's really important that here you are doing decision about your oral health, about your dental treatment. So rather than relying on any unverified social media person, it's better that you seek medical advice or dental advice from the dental professionals. So in the nutshell, I would say that we must trust, advise our patients to trust evidence, trust the qualified professionals who have spent, all their lives trying to give you the best care based on the available evidence. And for making decisions, they should always consult dental professionals rather than believing on any unverified social media influencer. So yeah.
Well, I appreciate your perspective because, I love the fact that you are a clinician beyond a researcher. And I think what's really great also is your role as the director of the undergraduate program, because you have an opportunity to shape mindset. You are also training young general practice dentists, which will understand the value of efficacious treatment. And I very much believe, especially when it comes to retreatment and management of the periradicular space and the, I'm speaking nerd talk that you and I understand, but the apical resorption of these retreatment cases, they are sophisticated in management, in disinfection, and then in sealing. And so I would hope that with this broader message is not just about like doing root canals, but doing them in an efficacious manner by the people best equipped knowledge-wise and equipment-wise to handle the issue. So
yeah,
it wasn't meant for me to kind of give a soliloquy, but I just kind of wanted, if you wanted to add to that point.
No, I completely agree with that. And I tell my postgraduates as well that, you should not really focus on aesthetic, root canals, which obviously the white lines that we appreciate, that it's filled, the lateral canal, so it's really disinfected. Rather, you should look what you should understand what is the rationale behind and what we are trying to achieve, and that is disinfection of that area efficiently. So yeah, I completely agree and second what you've said. It's really important that those basics, they should be completely grasped, when we are doing the treatment. So yeah.
It's such an honor to be able to speak to someone across the pond who's ideologically, I didn't realize we would be so similar in the way we approach things, but I really thank you for your time. Is there something that you wanted to talk about? Do you feel like we covered most areas properly? Do you feel you were able to speak about the things that you're most proud of in this paper and in your body of research?
I think yes, I think I really enjoyed our conversation. I think you know it was a pleasure, because obviously all the things that you said, they are the things which have just come out from this research. And especially the clinical side of clinical implication side of things, integrated, care for the patients. We talked about the misinformation. So thank you so much for, giving me the opportunity to share this. And it was really, delightful to speak to you on this topic.